The Chief of Staff says the initiative, together with the Mama Cares program, demonstrates the government's strong commitment to improving healthcare delivery and enhancing the well-being of citizens.
10 months into our administration, I am pleased to report that we have already uncapped the National Health Insurance Levy, which will make available an extra 3.4 billion cedis into the fund this year. This will go a long way to support claim payment, operations, and administrative functions. We are beginning to see the impact. Rapid claim payment. As of today, the total amount of funds disbursed by NHIA for this year, 2025, to healthcare providers is 2.8 billion cedis. This timely injection of funds is increasing provider confidence, encouraging compliance, and driving enrollment growth.
For Health Minister Kobna Minta-Akando, the National Health Insurance Scheme remains sustainable and resilient despite a reduction in foreign aid, attributing this to improved domestic resource mobilization.
Domestic resource mobilization, which we must not take for granted. And that is why we are not experiencing issues like, because there is a cut of aid, we are not able to pay claims. Because there's a shrinking aid, we are not able to pay claims. When you have a strong domestic mobilization of resources, there are no strings attached, and you are able to invest the resources where it is needed most.
Chief Executive Officer of the authority, Dr. Victor Asari Bompo, described the initiative as unprecedented, noting that it has enabled the authority to pay service providers every month, a significant improvement from the previous system of settling month of arrears.
Amazing. We have 3.4 billion cedis more. As you heard in some of the delivery, it's been unprecedented that the National Health Insurance Authority would be making payments on a monthly basis. And up to date, we've paid most providers up to the month of August and even some up to September. It's never happened before that we'll be paying on a monthly basis. I remember in my previous foray into government and after, payments were actually 2 months, 3 months, 4 months. This is revolutionary, that every month service providers receive payments. And I think you heard the Director General of the Ghana Health Service also talk about the fact that now there is a switch. At first there used to be complaints about non-payment and withdrawal of services because NHIA has not paid. Now he tells us, these are his own words, he tells us that he has to actually encourage the facilities under his direct control to put in their claims because NHIA is paying.
The two-day conference brought together stakeholders from across the country and various sectors to discuss ways to improve the scheme. For Joy News, Fatal Bayaga, Accra.